Greetings. This is Pat McGuire, and I promised you I was going to give you information on healthy living, and today, because of different questions I've had, I'm going to talk about diverticular disease, how it happens, and how to help your colon. Now, on this side, you see a normal colon, and the colon is the large bowel. And it starts out here with this little thing called the appendix, then you get into the colon itself, and these little things you see along here are just a little bit of fat, which we all have. But as you can see, it's very smooth. So when we end up with diverticulosis and diverticulitis, what you have are pockets or outpouchings within the intestinal wall. Now, there are theories as to how these occur, but most of it has to do with a combination of low fiber, motility of the bowel itself, and then changes within the lining of the bowel wall, which is called the mucosa. Now, most people, especially by the time they hit 60, over half of people by the time they hit 60 will have diverticula or diverticulosis, which means a series of these little pouchings. But most people don't know they have it unless it's found during a colonoscopy, because the majority can be asymptomatic, which means no symptoms whatsoever. Now, it has been felt that low fiber diet that can cause problems with constipation increases the amount of pressure the bowel has to use to move the fecal matter along, and that can cause weak spots, which then creates these outpocketings. If one of these pouches or outpocketings gets inflamed or gets infected, which can occur if, let's say, little pieces of fiber or seeds get caught in here, it can lead to what's called diverticulitis. So osis means condition, having a situation. Itis means inflammation or damage, and inflammation and damage and infection can occur, and you can have bleeding into it, which is why you see quite often when you have an attack of diverticulitis, you will have some bleeding when you have a bowel movement. So we look at this, and as I said, diverticulosis can start at the top, and about one person in 10 around age 40 will have diverticulosis. It's fairly rare under age 30. Now, the majority will be asymptomatic, but 20% will have what's called diverticular disease, or DD. Of those, 15% are complicated, and we'll get into some of that, but 85% have few symptoms, but basically they're uncomplicated. They can be taken care of at home. Of the complicated disease, there's also called an uncomplicated diverticulitis and a complicated diverticulitis. Looking at that, the symptoms, they vary, but you can have problems with ongoing constipation, ongoing diarrhea. Frequently, you complain about a tender abdomen, cramping or bloating. You can have fever, because again, we're talking about inflammation and possible infection, extremely painful bowel movements, blood in the stool, and nausea and vomiting. So when you get those types of symptoms, it's important to see your doctor. The treatment, which they're now rethinking for mild to moderate diverticulitis, would be antibiotics. Definitely with severe diverticulitis, it might be even IV antibiotics with hospitalization. If it's complicated, which would be that complicated diverticulitis I mentioned on that graph, or that diagram, which could be an abscess, a perforation, which is a tear or a hole in the wall of that part of the colon, it may require surgery. Now, this is a rare situation. The treatment starts out with clear liquids. You're talking about water, clear soups, Jello, things like that. And then as they get more stable, they can have some cooked vegetables, but keeping it low fiber while it's inflamed, so they don't use skins or seeds. They will allow, as things get calmer in the colon, fresh fruits like bananas, cantaloupes, honeydew, and watermelon, because they don't have seeds most times that we swallow. Although with watermelon you have to be careful because you could. Then there's a slow, after about 6 or 8 weeks, there's a slow reintroduction of raw fruits, vegetables, nuts, and maybe seeds. There's a little bit of conflicting information about seeds and diverticular disease. Some feel that it aggravates it, but others have not. Other researchers have not found that. Now, while they're still getting the bowel calmed down, they would introduce some white breads with no nuts or seeds, so no whole grain breads, white rice, and several sites have suggested this, but I bring it up as a possible risk of increasing whole body inflammation would be the introduction of eggs, fish, poultry, and dairy products. Now that is a topic of a different post, but just allow me to say that this might slow down some of the process because it can cause some inflammation in the body. How do you keep your colon healthy? Most of the research I was going through is saying we can't 100% say that if you, for your whole life, have a very high fiber diet, you won't get diverticulosis. But they did note that in Western Africa, individuals who had a very high fiber diet did not have diverticulosis, whereas people with Western diets, such as us, do tend to get it. The Asians get some, but they get it more on the right side rather than the left side, which is basically at the far end. But they have all pretty much agreed that if you have diverticulosis, you really should have a high fiber diet because that allows the stool to go through in a much softer format and much quicker so that it doesn't linger by those diverticuli. So I think that's important to realize. Now, this is my own thought, is that probably part of the reason they can't say for sure if a high fiber diet will prevent diverticulosis is number one, they've never done the study, and number two, that would mean that from infancy on, a child is brought up in a whole food, plant-based diet, and they can follow them for 30, 40, 50 years. And there's not a lot of money in that because we don't have big spinach companies and big broccoli companies to help underwrite this. So that's where they're saying that they can't prove or disprove, but they do know that once you have diverticulosis, they know that a high fiber diet definitely can decrease the risk of inflammation and cases of diverticulitis. Now, one question you might have is how much fiber do you need? Right now, the average American takes in about 15 grams of fiber a day. Different studies have said it should be anywhere from 25 to even 45 grams of fiber a day. And the 25 they say for women and higher for men, but I can tell you that for most people to be healthy, you really need to be definitely over 30, and it doesn't hurt to be higher. So saying 45 for women and men and kids, it just will allow us to have healthier guts. The other thing that can keep the colon healthy are probiotics. And probiotics are the gut bacteria that we have that help with the digestion of our food. It helps with immunity, and it just helps just with overall health of our body. We also know that with gut health, you have better mental health. Again, I found a couple of studies that questioned if we actually needed probiotics, but the majority were very positive about it. And I know I've talked with a couple of GI specialists who feel that probiotics are very important for gut health. And so I really would recommend that as a daily. It's not just when you get a flare, but as a daily because it's a prevention rather than an intervention. Now, I did tell you that I am an ARBONNE consultant, and so I'd like to let you know that ARBONNE does have two products that indeed will help in these areas. One is their Fiber Boost. and the other is our Digestion Plus. The Fiber Boost is all plant-based. They have different pectins from apple and pears and other fibers that can help with digestion. It can help with bowel movement. It can help with lowering cholesterol because cholesterol gets absorbed by fiber. And the serving size is much larger than what you get from Benefiber or Metamucil as examples. A serving size of Fiber Boost is 12 grams. Now, I told you the average person takes in about 15 grams a day, and yet it should be more than twice, closer to 3 times that. Well, this 12 would be almost half of your daily intake. It's easy to digest. It doesn't really have much of a flavor, if any. It can be used in cooking. It can be used as a drink. I put it into my protein shakes every morning, and sometimes I sprinkle some on when I have a peanut butter sandwich on whole grain bread. This is a good one because it's all plant-based, so you don't have other elements that can cause inflammation or problems. The other one is Digestion Plus, and that has a prebiotic, which actually is a kind of fiber that the gut bacteria use to grow. Then it also has probiotics. In addition, it has digestive enzymes that help break down what we're taking in so that we can absorb the nutrients from it easier. So if you have any questions about either of these products, if you're interested in trying them, please just either private message me here or leave a post note that you're interested, and then I can private message you and we can talk more about it. But I thank you for checking this out today, and I look forward to giving you more information about other ways to have healthy living. This is Pat McGuire, and have a happy weekend.